Good morning, everyone. Welcome to the very last day of April 2020. Tomorrow is a new month, and also welcome to the Vine Health Daily Live COVID-19 update. This update is meant to bring you facts from the previous 24 hours and to also give you tips on, on just thriving during this time. We make it a point to make sure that everything we say here or I say here, is factual and not based on propaganda or myths. So, and I find that it's very important that we share truth to help us to thrive during this time. So yes, we're doing it. Day 46. This update started a week before the lockdown in the UK. So you've been home now for over 4 weeks, and you're here and you're surviving. So well done to everyone who's carried on. For those working from home, I'm sure you have now possibly adjusted quite well to being to working from home, and you've developed your own niche. For those who are furloughed, then this is a chance to develop a new skill. And if you're out of work or struggling financially, just seek all the help you can get. And if you are in a dangerous situation, sort of domestic violence or that sort of thing, please ask for help. Send a message to somebody who can help you. So what's happened in the last 24 hours? I think a lot has happened. I think maybe I'll finish with the United Kingdom this time, because there's quite a bit of positive news in the United Kingdom, which is quite nice. So if I start with just briefly from Nigeria, the number of cases is now at 1,728 with 51 deaths so far. Again, that's wonderful. That the number of deaths, even though every death is important, but the fact that it's not escalating massively, it's a good thing. And then being able to find out in the community what's going on is fantastic as well. So I expect the number of cases to increase, but number of deaths to sort of flatten out. And then, and everything is going to be reopening slowly next week. The economy of Nigeria needs a lot of help. We've got loans from IMF. The country is in debt. Oil is not a good way of sustaining the economy. So you have to start to think about other ways, really. After COVID-19, this is the time to start to think about going back to our roots and back to agriculture and manufacturing and things that are more sustainable. The United States, again, a lot of drama. The deaths in the United States is now over 60,000, but they have completed the trial. I'll talk about the drug called Remdesivir. Remdesivir is an antiviral which was developed for Ebola. And a trial has been done in the United States which has shown some promise. Whenever I hear that a clinical trial has been done, I always want to look really, really closely, because if you don't look at the detail, you'll be blown away by the headlines. Anyway, Remdesivir is an antiviral which was tried in about a cohort of about 1,000 patients, just over 1,000 patients. And it was randomized to those who were given Remdesivir and those who were not. It was found that for those who were given the drug, they shortened the illness by about 4 days. So it shortened the illness. There's no evidence that Remdesivir will reduce deaths, but there's evidence that it will reduce the length of the illness. It's like having shingles and taking a cyclover. It will just shorten the illness by a bit, but the illness will still continue. So it's shown some promise. So I suppose people can be prescribed Remdesivir as soon as they feel ill, and hopefully they won't have to go through 15 days of illness. But it hasn't been shown, from what I can read, to reduce the mortality rate. So it's one of the ones that's shown promise. So that's Remdesivir. And because I know yesterday when I came on, I said there was nothing that worked. But, in the last 24 hours, we've had this news. Although Remdesivir has been going on, we've had this news now that Remdesivir can shorten the illness by a couple of days. So that's America. I mean, lots of countries are reopening this week and next week. The Chinese parliament are going back on the 22nd of May. In Switzerland, their football league is going back on the 8th of June with some social distancing measures. Germany, they are easing their lockdown. The shops have reopened, but they are postponing international travel until 14th of June, and then they will resume it then. South Korea, no new cases yesterday. Just wonderful news all around the world, which is really, really good. So there's hope really. Lufthansa, they're still flying. Lufthansa have said they've introduced face masks. I think they're the first airline now to introduce face masks for every passenger who's going to fly on their aircraft for the foreseeable future. From when you check in to when you land, you must have a face mask on, which is common sense, really. So the whole world is beginning to go back to normal. Are you ready yourself to start to think about coming back out again, despite what's going on? And in America, over 31 states are reopened partially, despite them not meeting the phase 1, 2, and 3 guidelines that were set out. Trump has no plans to extend the social distancing measures. He just wants to get on with the elections, I think. Now, just to finish off, I'll talk about the United Kingdom. The United Kingdom, lots of positive news. We haven't hit 100,000 tests a day, but that should be met in the next few days. So lots of testing going on. So if you feel like you have symptoms of coronavirus, you can get tested. So get your test. If you have a cough and a fever, then you can get a test done, and that's wonderful. The number of deaths in the United Kingdom, I must tell you, has significantly increased between the day before yesterday and yesterday. But that's because now we are counting everyone rather than just counting the hospital. So the deaths stands at 26,097. Well, that's because community deaths have been, care home deaths have been counted. Everything is being counted. I don't know if other countries are doing the same. So it might look like it's a lot, but it's because everybody's being counted, which is wonderful. Now, for Black and minority ethnic staff on the front line, we've been shouting for a while that they're dying more than their Caucasian colleagues. And many people have now come out to say that we should remove Black doctors and nurses from the front line and let them take a back seat and let others do the work. It's whether that's possible, I don't know, because the NHS relies heavily on us. But that's what people have been suggesting, that those who are at risk, particularly older, people over 50 who are Black or Asian, should not be exposed to COVID-19 patients. It seems sensible to me. But a lot of Royal Colleges have come to say that as well. Just to finish off on a very, very, very positive news, I'm sure you've all heard about this gentleman called Captain Tom Moore, who turns 100 years old today. And he was raising money for the NHS. For the last month by walking the length of his garden 100 times. And he planned to raise £1,000, but he ended up raising 30 million, over 30 million pounds. I mean, what a way to live. What a way to live beyond wealth, living beyond yourself, understanding that it's not just about you, but about other people. So, just giving of yourself. It's more blessed to give than to receive. I mean, he has received so much accolade. He has got over 120,000 cards. He's been made an honorary colonel. But I can tell you that I'm sure that was not the reason why he did this. He wasn't doing this for accolade or for popularity or for kudos or for any of that. He did it because he appreciated the healthcare system that has helped him, and he wanted to give back. And in that process, the outpouring of love that he has received is just overwhelming. And whenever I watch it, I'm just choked up. I feel like crying because it just embodies what life is about. Life is not really about just eating and drinking, about your comfort, about you having money. It's about what kind of impact can you leave in the life of somebody else. When you are gone, how would you be remembered? It's all very transient, but let's just be able to give of ourselves. It's not just about, just us. It's not just about just you, but about everybody. So I'm really proud of Captain Tom Moore, who is now Colonel Tom Moore. And, it's just a lovely, lovely feeling. And for everyone who gets to see this video, and please share and like and follow, and just for everyone who gets to see this video, please just take one thing and just do it for somebody else. Imagine just do it that it's not for you, but for somebody else. And just imagine how far that would reach. And I'm just, too impressed with him, and just such a lovely man. So yeah, if you haven't heard about him, I'm sure everybody has heard. If you haven't heard about him, Google him, check him out, send him a tweet, just show the love. But for one man who's 100 years old to raise over 30 million pounds for the healthcare system, it should make all of us think differently about how we live our lives and how we give. So that's him. And yeah, we're really impressed. Tonight is a clap for carers. As you all know, I'm not really a big fan of clap for carers because I'm like, I want PPE for carers, but it's a big thing now. So if you do choose to clap for carers or for any frontline staff, to be honest, I want to clap for my local supermarket because they made my life so easy. There are so many people that have made this period just great. So let's clap for all of us. Let's clap for ourselves for staying indoors. Let's clap for everybody. I think we've all done really, really well. It's just amazing. So I'll be finishing off there today. I'd like you to please share the video. I just do it at various times. And the reason why I don't have a set time is because I work and I have to sort of speak to patients and see patients and go into work. So it's basically I'm fitting it in between my daily work. So I can't have the set times. And I know that that's a bit destabilizing for some of you who look out to see my videos and I just suddenly come on. It's not because I don't want to give you notice, it's because I simply can't give you notice because of my schedule. As you can see, I'm in my scrubs, which is great. So I'll probably do some work calling patients this morning from home, and then I'll go off into the practice and do the rest from there. But it's fine. I'm enjoying doing this. I'm enjoying giving. And I hope that whatever I say makes a difference to you, to your families, to your loved ones. And please share the video. Now, tomorrow, again, I always talk about money on Fridays. If you have, just join me to talk about money. I talked about domestic violence. Next week, I'm thinking of tackling the issue of domestic violence. From Monday, maybe to like Monday, Tuesday, maybe Wednesday, is a topic that I tread very carefully around because it's so complex. And having dealt with victims for over the years, I know that it's not very straightforward, and I really don't want to make a misstep. So I will tackle domestic violence because people are in such situations at the moment, but we'll do it very, very gently. But yeah, so I think next week we'll talk about that. All right, guys, thank you for watching. If you only joined at the end, please watch from the beginning. Share it on your page. Like Vine Health. Just follow us and, just do the best you can. And you guys have a wonderful day now. And I'll see you tomorrow for day 47.